Hi, my name is David Rubenstein, PhD. I'm here to talk to you about brain injury. And the first thing I want you to know is that the CDC has been keeping track of brain injury in the United States population. And what they found is the following. 1.2% of the population has a brain injury per year. And if you do the math and you go out about 70 years just before the age expectancy of each person, that means that at least 87% of the population in the United States has had at least one brain injury. Now, here's the shocking part. None of the injuries that we have as a child, a 2 or 3 year old toddler running around bashing your head frequently, are counted in those statistics. And nor are there any real statistics, because those little bumps on the head, the little goose bumps that you get when you're a little kid and when you're a young teenager, we think that they don't really count. Well, the science is beginning to point in the other direction, and it means that brain injury is becoming the silent epidemic, as it's been called, and we need to really look at how many of us really do have a brain injury. Now, on the website, you will find a brain injury checklist. You can download that, print it out, and you can see for yourself the likelihood or not of how much or how little brain injury may be in your medical history. Now, the reason I bring up brain injury is because that's how I got started in my career of studying the brain and looking for a really meaningful way to powerfully transform what we call today post-concussion syndrome. Post-concussion syndrome has more than 120 symptoms and are often diagnosed and connected to other maladies or disease processes, and really it's begun by a head injury. Now, brain-body calibration focuses in on what we call the architecture of the synaptic discharge. In other words, the shape of the electrical discharges within the brain that gets disturbed by impacts and trauma to the head is the focus of brain-body calibration. And in this way, we are able to trigger the brain to reinitialize proper shapes to that architecture of the synaptic discharge. And so in the screen to the left, where you're going to see a picture, and you'll see that that picture has been changed just a little bit. And when it changes just a little bit, you can't recognize what it is. And then when we show the other picture, you can see that, right away we can recognize this. This comes from the fact that the human brain is designed to generate a set of signals that do things for us in our brain, thinking, feeling, experiencing. And impacts to the head appear to change that program, that architecture, just a little bit in the brain, and that accounts for many of the symptoms that we see. And so the key is to get the brain itself to be triggered into a state that it changes back to that optimum or normal architecture of the synaptic profile, and in that way the symptoms abate. Now, the statistics that we have so far on brain-body calibration's effectiveness for post-concussion syndrome are remarkable. Well over 95% remission of symptoms is the average that we have so far, and in some cases a complete disappearance of the symptoms of post-concussion syndrome. One final note. Many of the scans that we use, such as SPECT scan or EEG-based scans, may or may not show the symptoms of post-concussion syndrome, or traumatic brain injury is another name. And the reason why that is so is that we haven't yet reached the level of detail that we need to actually see the architecture of the synaptic discharge. The scans that we have, wonderful though they are, may not be able to show. So we know, for example, that patients go into getting scans because they're showing signs of brain injury, and the scans show that they're normal. So the reason why, going back to that test that you can access online here at the website, is it's another way to cross-reference some of the symptoms so that you can pursue treatment such as brain-body calibration. Thank you for your attention. I'm David Rubenstein, PhD.